Hi, this is Dr. Lint Hutchinson with counselingexam.com, and I'm going to give a little presentation on how to prepare for the NCMHCE exam, the new DSM-5 version. Okay, before you start studying for the exam, you really need to know what areas you're going to be tested on. There are only 3 areas for this exam, but those exams cover probably everything that you learned in graduate school. They consist of assessment and diagnosis, counseling and psychotherapy, administration, consultation, and supervision. The last areas, ones that they've just recently added to the exam. Regardless of the fact that you need to know a really massive amount of information for the exam, the number one concern, and actually it's really a minor concern on the exam, is what is the difference between the DSM-4 TR exam and the current DSM-5 exam? Well, if you go to the NBCC website as of April 1st, they've posted the changes that they are making in the exam from the DSM-4 to the DSM-5. And here's what they have to say. The NBCC is pleased to report that there were no major structural changes to either the NCE or the NCMHCE as a result of the DSM-5. There were no changes to the framework or the competencies of either examination. The knowledge accessed is common to both manuals. Modifications to the exam content involve changes in diagnostic terminology only. So what's that mean? They go on to say, while the number of items regarding the DSM-5 will not increase, the new edition does contain new diagnostic terminology, so reviewing the difference between the 2 editions may be helpful. First of all, you need to know the criteria for the new disorders in the DSM-5. Once you have that down, you need to know the combined specific disorders in the DSM-5. So here they are. Here's the new disorders: social pragmatic communication disorder, disruptive mood dysregulation disorder. All of these, some of them were in the appendix of the DSM-4 and they made it into the DSM-5. But these are 15 areas that are new that you need to make sure that you have a handle on. So these are the combined specific disorders in the DSM-5. So they are combined disorders from the DSM-4. You need to know their makeup, and here they are: language disorder, autism spectrum disorder, and these may show up on the exam. So you need to know what they're made up of, and here they are. So you see, if you didn't study these in graduate schools, now would be the time to start. Working with students on the NCMHCE for the last 15 years, I've found that generally students that pass spend between 200 and 300 hours preparing for this exam. Since April, this is the number one questions I've received from test takers. I already have a copy of the DSM-4 TR, and that's what my agency is currently using. Do I really have to have access to the DSM-5? And the answer is only if you want to pass the exam. With the limited amount of time that I have left, let's go over some basics that will make your life easier while studying and taking the exam. We're going to go over the assumptions of the exam, the rating scale, information gathering, decision making, and for the DSM-5, well, you're on your own. It's always a good idea to have a concept of what you can and can't assume regarding the exam. Here are some of the assumptions of the exam. While taking the exam, consider yourself an individual therapist in private practice, or working in an agency, or school setting, or a group home, or even a prison. In other words, you're a therapist and you may be working in any kind of situation. You are also a competent therapist and have a knowledge base to treat all diagnoses in the DSM-5. And on the exam, you can select assessment tools that are relevant to the case study. Assume that you have been trained to give or do an evaluation using all assessment tools. You should not base your diagnosis on insurance concerns. Diagnose and treat the client as you would in a perfect world. One of the things on the exam that trip people up is once you select an option, you can't unselect it. So you need to really prioritize these before you start just willy-nilly checking something off. Diagnoses, treatment items, and assessment instruments presented in the simulation are real and do exist. I had a student that missed a number of points because one of the options was the Burns Depression Inventory or checklist. And they thought, well, that's got to be made up because I know about the Beck Depression, DBI2, but since this seems like it's maybe made up, they didn't check it. Simulations can wander, seemingly looking like a specific diagnosis, but along the way add additional information that changes what your final diagnosis will be. And on the options that say choose only one, you have to continue selecting until you get the right answer. So it won't let you go on until you actually get the correct answer. So you can lose a lot of points. So be really careful with the choose only one options. Some other ideas that you need to be concerned with is on the exam is that there is no deception in the case study or simulation. For example, if Kelly's husband has just died and she claims that she is not upset and she's doing fine, you need to take this as the literal truth, and Kelly is not in denial. That would probably be your first thought on the matter. But no, take it as truth. Okay. Option uncovering scale. This is the rating scale for each of the possible answers for every question, and they are based on the degree to which the client is affected. So when you make a choice, know you're either getting 3, 2, 1, 0, -1, -2, or -3. Positive 3 points indicates that your choice was the best choice that you could make. Omission would result in serious damage to the client in terms of cost, time, pain. 2 is strongly facilitates good client care. 1, it mildly facilitates good client care for the client. 0, and sometimes you'll get a 0. Of course, on the exam, you'll have no idea what these points are. They don't show you if you got it right or wrong in terms of the point value. 0 does not contribute to the client care. It doesn't hurt them. It doesn't help them. So you get no points for that particular choice. -1 means that you mildly detrimental to the client in terms of cost, time, risk. -2, sorry, seriously is detrimental to the client. -3, you need to probably change in your therapy license and become a bartender. You've damaged the client. Your risk of basically being sued. So this is not a good option. So, overlying principles for uncovering items. Everything uncovered should be directly linked in some kind of logical manner. So when you begin this exam, think in terms of diagnosis just from the beginning. The items that you uncover, the ones that you choose, should be linked back to the symptoms, problems, and level of functioning presented in the case study. You need to address and treat everything that is written in the simulation. You have to address everything. For example, if the case says the client has problem 1, problem 2, and problem 3, and you must treat all of those 3 problems, even if treating the first problem would make the second and third go away. For example, let's say you have a simulation where an individual, let's say Hamilton, is a student in high school. He spends most of his time in his parents' basement smoking weed with his buddies. And since it started, his grades dropped. His parents have threatened to disown him. But during therapy, Hamilton stopped smoking weed, and his other problems, which would be the bad grades and his relationship, will probably go away. Even so, in that simulation, you need to address all 3 problems that the client had. Okay, areas of the exam. 2 areas: information gathering and decision making. Both information gathering and decision making areas have an aggregate score based on the total of the 10 simulations. You must pass both the information gathering and also pass the decision making to have passed this exam. Does it mean you have to pass every simulation? No, it doesn't. The points are given for correct responses and they're deducted for incorrect responses. But you have to have passed the set score for the information gathering and decision making. Do you know what that score is? No. The NBCC doesn't give out that information. So the passing score in each one of those areas is sort of debatable at this point. Information gathering. Information gathering deals with how well you can gather appropriate clinical information required to evaluate whatever situation that's occurring, and also information gathering deals with, did you ask the appropriate questions for the client? Decision making. How well can you utilize the information that you gathered in making judgments and decisions? Can you make decisions that resulted in the best treatment for the client? So this is how I remember the information gathering, what you need to know. So you can see this is a much more complex than just knowing the diagnosis for the DSM-5. So information gathering, SPLAT, symptom identification, problem recognition, level of functioning, assessment tools, and treatment progress. These are all areas that you need to be competent in. The other area is Decision making, and I remember that by toasted. Treatment techniques, objectives and goals, adjunct services, services during treatment, termination and referral, ethics, and diagnosis. So you see, diagnosis is just one section of a whole conglomerate of information that you need to know. So, in summary, putting it together, you have to have some map in your mind of what you're going to be doing to go ahead and address these simulations. These are not real world kinds of situations. They are pretty much theoretical in nature, and many of the things that you do in private practice or have been doing in an agency would be considered incorrect on this exam. For example, you probably would want to make sure that you had a medical history on the client when they came in. But on the exam, you wouldn't always choose medical history. It would just depend on the specific situation. So, here's a pre-diagnosis flowchart that you need to think about. When the intake information, for you to think of a preliminary diagnosis, you have to look at the presenting problem, looking at results of assessment tools, family information, developmental issues, medical concerns, and career, based on the case study, which applies and which doesn't. From all this information, you need to start to think in your mind of a preliminary diagnosis. Once you have a preliminary diagnosis, then you look at the treatment approach, looking at the client's strengths, interventions necessary, treatment goals, professional issues, and then as the simulation continues, sometimes you'll find the diagnosis change with additional information. So you need to adjust your diagnosis. And look at, once you do have a diagnosis, what your treatment plan is going to be, adjusting those treatment plans, and finally making referrals for that particular individual. Well, this has been a quick overview of some of the things that you're going to encounter when you go to take the NCMHCE. We have a website that can help, counselingexam.com, and my email address is helpme@usa.net. Good luck on the exam, and I know that information is somewhere in there.